On this edition of Native Report, we look at the impact of the COVID-19 pandemic on two Native communities. We then interview two Native American journalists and learn how they're reporting on the COVID-19 pandemic. We also learn what we can do to lead healthier lives and hear from our elders on this Native Report.
Production of Native Report is made possible by grants from the Blandin Foundation, the Duluth Superior Area Community Foundation, and the Shakopee-Mdewakanton Sioux Community.
Native leaders across Indian country are doing what they can to help their people during this time of the COVID-19 pandemic. There are similarities across Indian country, and we talked with the leadership from the Navajo Nation and the Shinnecock Nation about their experiences. One thing that we learned, they would like their voices to be heard.
As the pandemic began, what were some of the resource inequities that the Native nations faced, yours in particular, that put members within the nation at a disadvantage?
Here on the Navajo Nation, not everybody has running water. Or a large population is still hauling water for their livestock and also for the household use. So when the CDC and the federal government and we as leaders tell our constituents, our citizens to continuously wash their hands with soap and water, sometimes we just don't have that amount of water to do that on a periodic basis.
In terms of the epicenter, Suffolk County now has become the epicenter. That's the county that we're in of New York. And part of the reason for that is because so many of the city people have come out here to the Hamptons to get away from the city. They have their homes out here in the Hamptons, and it has brought with it the virus. It has brought with it empty shelves in the stores. So it's been quite a dilemma for us who live here year round, because most of the time they only come out during the summer. One of the first things that we did is we set up a food distribution tent, to provide food for our people, so that would hopefully limit the amount of our people having to go off res to the grocery stores and to town or to some of the other towns to purchase food. And I was on the food line one day when we got the middle of it, when it really started getting bad out here. And that's the first time that I saw fear.
What about broadband? I know that's a significant issue across Indian country.
Here on the Navajo Nation, we don't have the best internet access by high speed. I'm fortunate to be in the Navajo Nation capital, where we got some good cell service. So I'm on cell service right now. And throughout the Navajo Nation, there are dark spots throughout many areas. And so when schools are canceled, university and college students are told to go home and do online courses, it's a concern for us, because I hate for our youth to fall behind in their studies. And I know high school students are being told to do online courses as well, but here on Navajo, we don't have the best high-speed internet. But you know what? We are doing hotspots throughout the Navajo Nation, working with some of the carriers, some of the companies here, maybe 12 or so hotspots throughout the Navajo Nation, so that students can go to these parking lots during the day, not during the lockdown, but during the day, so that they can catch up with their work.
Can you shed some light on the health disparities that some of the Native nations have faced since this pandemic has hit those communities a little harder than some?
In many tribal communities throughout the country, or even in people of color communities, there are high rates of diabetes, cardiovascular disease, and a lot of health problems. Here on Navajo is no different. I think this last statistics I got from the diabetes group here is that 1 out of 4, 1 out of 5 have diabetes in Indian country, and that's alarming. And those individuals are in that category, the most vulnerable population. And so we need to care for them. A lot of them are elders as well.
As the pandemic spread, I understand that both the Navajo Nation and the Shinnecock Nations had some issues with regards to receiving funding from the federal government. Can you shed some light on some of those issues you've had?
When you say you're from New York, there's automatically this notion that you're a city tribe. And we just had that in discussions with IHS, Indian Health Services, where they were sending the Abbott ID Now testing analyzers for the COVID virus here, and they sent them to every tribe around us. And when I called to inquire why, they said, "Well, you're not a rural tribe," and that is really misleading, because we absolutely are a rural tribe. But as soon as you say New York, there's this automatic perception that you're in the city or you're by the city, and that's not the case. They told us that they go by zip code, because I called up. I was on one of the White House calls, and then I was on one of the IHS calls that they've been having every week. And I was inquiring. I said, we're in the epicenter of this here. It was definitely frustrating for them to have classified us without even talking to us.
And how about you, President Nez?
We had 3 legislations that were approved by Congress and signed into law by the President of the United States. And we haven't seen much of that at all in an Indian country. And so, we're not going to just feel sorry for ourselves and roll over. We're going to say we're going to utilize our own resources and our own laws here on the Navajo Nation. We're a sovereign nation. We had to appropriate $4 million of our own money to help out with the emergency operations here. But don't get me wrong, I'm going to put all the receipts together and send them back down to federal government, make sure that we get our compensation, and the money, as you know, is for the citizens of this country. And it seems like, once again, I hate to say, the first citizens of this country have always and are being ignored right now in this pandemic that's sweeping across this country of ours.
Is the pandemic bringing to light any other challenges that Native nations, particularly yours, are facing when it comes to receiving funding and other forms of resources?
We had to apply to CDC because the money that was allocated to tribes, they go to the federal departments, the federal agencies, CDC, BIA, IHS, and we have to use the same process. Tribes have to use the same process as we do every year when federal monies get appropriated. And it's an emergency. They should be going directly to these tribes, tribal governments, just as they are going to the states, the counties, and municipalities out there. But yet we have to develop a whole packet and submit it as a grant application.
The states and the counties just get it automatically, but we have to go through. I was just looking at some of the paperwork, and you have to give your budget, your numbers from last year, your expenses and everything from last year, from 2019. So there's a number of different documents that we have to put in, and then we don't know how they're going to disperse this.
How can some of those challenges be better? In particular, what is your nation doing to alleviate some of those issues?
By raising the awareness of the issues in tribal communities throughout the country. Your tribe, my tribe, all 500 plus tribes throughout the country. And I see that people are now recognizing that there are regulations, laws that are barriers to getting finance dollars to tribal communities, those resources. And it takes a very long time. Sometimes we as tribal leaders, we have to shout loud, and that's the only way to get the attention of the government that we're supposed to have a nation to nation relationship with. And so when we signed that treaty, we recognized that we had a partnership with the federal government. We said, United States of America, if you're ever in trouble, we will back you up. Those broken promises from the federal government towards the tribes is numerous. But here for Navajo specific, and I'm sure your tribe too, we've helped the United States of America in many ways. Look at our code talkers in our communities. Look at even the help that we're doing right now with our latex glove manufacturing facility here on the Navajo Nation. Getting the PPE equipments for our healthcare facilities and our doctors and our nurses, and not just here on Navajo, but all across the country.
It's one of the reasons why, tribes are out here trying to become economically self-sufficient. You have gaming tribes, you have tribes with the oil reserves. You have tribes that are out here trying to make themselves economically self-sufficient so that you don't have to be reliant upon these governmental funds, But then there's a big but in there. We also know that the federal government has an inherent trust responsibility to the tribes.
We've all gone through some trying times as a people, Indigenous people in this country. And here's an opportunity to share that with our younger generation, to know that we are strong and we're resilient, and this COVID-19 is not going to sideline us.
Buju and Dinaway Maganadug. And that means Buju is a formal greeting. There's Buju or Anin. Anin is more of an informal greeting. Buju is what you say when you love somebody, you respect somebody, or you haven't seen them for a long time. And Buju is what I mean. So I'm Dr. Arnie Vainio, and this is Health Matters. And this might not seem very doctorly, if that's a word, but this is maintenance. And you can see these brakes. I don't know if you can. So I'm putting brakes in this car, and you can see the rotor is discolored. So when I step on the brakes, this thing pulses, and eventually it's going to not stop the way it's supposed to. And the problem is, and it usually is, these slide pins didn't get greased last time. So these things are supposed to slide back and forth really easy, and they're stuck. So you can see that one pad wore thin, and it's worn like this. It's worn crooked, and the other one's thicker because this thing isn't going back and forth like it's supposed to. And what that has to do with medicine is either nothing or a lot. This is maintenance. This is taking care of things before they become a problem. So this is already becoming a problem. But diabetes, checking blood sugars. Checking blood sugars is a drag. And it's April 21st, 2020. In Minnesota, for the COVID-19 virus, there's 2,356 cases and 134 deaths so far. And it's hard to shelter, and it's hard to stay separated from everybody. It's hard not to see your grandparents. It's hard not to, for a grandparent to think about not seeing a newborn child for a long time. And, and all of this stuff is to try to keep this virus from spreading. And, but also, it's maintenance. Taking care of your blood sugars, checking your blood sugars, keeping your A1C down. People who get COVID-19 who are more at risk for severe illness and death are people with diabetes and chronic problems and lung disease and hypertension and a bunch of other stuff. And taking care of that stuff is maintenance. And it's taking care of a problem before it gets to be a problem. This is, when I'm not at work, we're sheltering in. So we're at home as much as possible, not going out. And Dennis Jones, who is going to be on this episode in another segment, Peibama Benes, is an elder I really respect. And he says to treat this time like a fast, to take this time to do an inventory of yourself and to look inside of yourself and to connect with nature again. And, that we're born with the ability to see the solution inside of ourselves. And we need to do that. We need to trust ourselves, and we need to respect each other, cut each other slack. This is stressful. People are out of work. They don't have money. They're worried about a lot of things. This society has never had to face this. We have had this before. Terrible things happen to Native people, and we survived it with our storytellers, and now our storytellers are artists and musicians and people who remember the things that we forget in the course of life. And taking care of things before they can become a problem. The pandemic is terrible, but there are opportunities in everything, and we need to look for those things. And this is a chance to reconnect, and a chance to try to look inward and fix things and come back to who we were. And this is also a time to reconnect with our elders. They're our history keepers, and that's all of us. It's not just Native people. And I'm not just speaking to Native people. I'm speaking to young people right now. There's a 10-year-old girl who sent me an email. Her father sent me an email, and she watches this. And for you, look for the goodness in people. People are going to show their good side. They're going to show their bad side. You can tell the difference. You know right from wrong. And remember that. And you don't have to show that bad side. And, everybody has bad days. But don't let that take over your life. There is hope for all of us. And we do need all of us. And do remember to call an elder. They've been waiting for your call. I'm Dr. Arnie Vainio, and this is Health Matters.
Native Americans have a strong storytelling tradition, and it is no different during this time of the COVID-19 pandemic. We spoke with two journalists about their experiences in reporting on the pandemic and what they're doing to bring the message to the people.
What's the most difficult story you've covered during COVID-19?
There was a mother and son. She was in her 80s. I think the son was in his 60s. They were way out in Navajo Mountain, this really remote community. They had been treated and sent home because there's no cure and there's not much they can do. So they were out in this remote community. There was no way for them to get food and water, and they both died at home. It seemed like that really got a lot of response, and people started going out shopping for their elders, taking care of their elders, making sure they were okay. It's hard to see families suffering, and it's kind of a helpless feeling.
What challenges have you faced during COVID-19?
Well, we had a scare, you could say, early on where a non-native employee of our healthcare system did turn up positive very early on. Fortunately, they did not have much contact with other people. As soon as they felt unwell, they self-isolated. They found out they were able to get tested, fortunately. Contact tracing, was followed up on, and there were no spread within the workplace.
The government is not real helpful about releasing statistics. For instance, they won't tell us exactly which community the cases are in. They're only giving us statistics by county. So it's hard. People want to know more, and we just don't have all the information, but we're doing our best. The IHS is only giving us the number of cases by county, and the counties out here are huge. I wish we could see more about what's happening in the hospitals. I'm hearing anecdotally that there are providers that are getting ill, and that are feeling overwhelmed. But those are stories we're not really getting because they're IHS workers and they're not allowed to talk to the press.
What do you fear most about COVID-19?
Well, since this virus is targeting the elders, and you know, as a Native person, how important the elders are to the community. They're the storehouse of the traditional stories, the herbs, the beliefs. And if we do lose too many more elders, I'm afraid it's going to affect the tribe as a whole.
Has the Trump administration stepped up to fully support the Seneca Nation during the pandemic?
I think it's it should just be very telling that during the negotiations around the stimulus package and legislation that um, many Republicans aligned with the Trump administration were trying to make the aid to Indian country be zero. And, they, I think, came with a middle figure between what NCAI was saying was a responsible and reasonable figure and the Republicans' offer of zero. So, yeah, the reality is we are um, not as far ahead with prevention of something like this because uh, government has not been acting responsibly at the federal level.
How are you distressing while you cover COVID-19?
Whenever I'm not crazy grinding, I do take little breaks during the day, and I split firewood for my wood stove, and I go out in the woods and I collect some food or some medicine, and get some spruce gum or get some wild ramps, wild leeks, and that stuff keeps me sane.
It's not easy. It gets depressing. Um, I notice the statistics, someone sends them to me usually between 6 and 9 p.m. and I find myself getting a little edgy, wondering how many new cases there are and wondering how many more people have died, wondering if this is the day the curve's gonna flatten. So far it's just gone up and up. I guess my husband's here at home. He's a teacher, so he's working from home too. So we kind of, cheer each other up and go for walks with the dogs and anything we can do to kind of keep our spirits up. And I don't know if you've been to the Navajo Nation, but it's a gorgeous place. And all you have to do is just walk outside, and you're overwhelmed by the beauty of the Red Rock country and nature and spring coming. So I guess that's what's kept my spirits up, is just going out in nature and seeing, it's still all there. All the beauty is still all there, and it will survive this pandemic. It will survive this generation, and it'll survive humanity.
I see this as a worldwide spiritual awakening and the quarantine as a way of fasting. It's a time for fasting. So what I do is I look at it through a cultural lens, and I look at what is the message here, what is going on, like that. And also, our prophecies have predicted everything that has ever happened to the Anishinaabe people. Like the Mishomis book, for example, in Eddie Benton's he talks about the 7 fires prophecies, and then this new age that we're in, this new time, this evolutionary time that we're in. That's where that book ended, and that's where we need to pick it up and figure out what is next in the pandemic. So I am I have 35 years of sobriety, and in my 35 years, I tell people in our programs that it is a spiritual awakening, and people that are in recovery, they know that it has to be darkest before the dawn. So everything has to get bad before it can get better. So when people are quarantined, they're kind of forced to look at themselves, and they're forced to evaluate and reevaluate themselves. And then how did I contribute to all of this? Whenever we can take ownership for what's going on in the world, we can make changes. But if we blame other people, we can't make changes. So in the recovery circles, I've been talking a lot about this, and been doing a lot of research in terms of prayer, meditation, reading books, looking at movies, listening to the wind, and just listening to the quiet voice of the Creator that Eddie Benton says that speaks not to the ear but to the soul, and just listening for those messages. I've always believed that the Creator speaks to all of us all the time. It's just that we don't all know how to listen. So now that we're quarantined, is the time to teach ourselves how to listen. Like, what is the message, and what is my role in all of this, and what can we do about it?
For more information about Native Report or the stories we've covered, look for us on the web at nativereport.org, on Facebook, and on YouTube. Thank you for spending this time with your friends and neighbors from across Indian country. I'm Michael Lagarde. Join us again for Native Report.
Rita Aspinwall is an enrolled member of the Fond du Lac Band of Lake Superior, Chippewa, and is an ICWA social worker with Fond du Lac Social Services. Ernie Stevens is a member of the Oneida Nation of Wisconsin and is a film and television producer.